in the medical doctor field, we give you something that lowers blood pressure, so we're suppressing that need for blood pressure. But the pressure, as a view as a homeopath, isn't the issue.
Yes.
It's a symptom. And so allopaths are great at symptoms. And you need that sometimes. If you're in pain, you want a pain pill.
Yeah.
I mean, you know, if you've had your leg broken, you might need something for pain. Or if you have a surgery, you probably want to be put to sleep before they do it.
Yes, please.
Yeah. I think I would.
I know. Yeah. So let's go back about the allopath. I don't think we actually went into definition of that since you are a medical doctor. So if you could explain to the viewers the detail of that definition.
Well, an allopath is a medical doctor, and that's our culture's traditional healing, allopathic. It means opposites, treating with opposites.
Sure.
If you do the Greek interpretation.
Okay.
So I'm an allopath and a homeopath, and I'm holistic, you know, and a family practitioner. So lots of labels.
Yes.
But allo meaning opposite, homeo meaning same. So like treats like, and then they use opposites treat the symptoms in the allopath. So that's the difference.
Well, a lot of
Terms.
knowledge there too, though. Not only terms, but you have a lot of knowledge in there in comparisons. And now you're practicing
Homeopathy.
Yes.
Yeah.
Wow, that's great, though. And to go to you to even know all of the variables and, you know, the alternatives, and you can actually even blend all of this together with all of your knowledge. And that
Well, I
would
hope
be,
to eventually.
Yeah.
But I can at least put it in the mindset and discuss it in both worlds.
Yeah, exactly. And wouldn't that be such a great way to look at the patient and treat the patient in both, and everyone blending together and complementing each other,
Yes.
you know, with all the
Be
knowledge.
novel, wouldn't it?
Yes, that's true. That's my goal. I know there's a few people over at the hospital, one of the hospitals, that are actually pulling in Healing Hands. My compliments to them, our kudos to them, as they say,
Yes.
for trying it, and they are succeeding.
Yes.
So perhaps this will also be a nice blend for you too.
Yeah.
That'd be great. So now you mentioned one of your patients with MS.
Well,
And-
she's fascinating.
Yes.
Because she really was disabled for 5 or 6 months when I saw her. And I actually put her on, instead of the pellet like I did for the little baby, I put her on a daily dose of medicine.
Oh, okay.
And it was drops like this. This isn't what she had, but she actually took 7 drops of this, put it in a quarter cup of water, stirred it 10 times and took 1 teaspoon, and did that every day.
Okay.
So very different. And this is called an LM, so it's 1/50,000 to, this happens to be an LM9. We're not using that. Usually we start out with 3, and I don't know why you start with 3 instead of 1, but it's all how we're taught, and it doesn't make difference. But you do LM3 for 1 month, and then 4, and then 5. You usually go up monthly.
Okay.
And these are $15 a month. So still reasonable within a copay.
Sure.
So she, about 3 months, she was not needing her cane unless she was tired.
Oh.
She could hold on to a pen. It wouldn't shoot across the room. Again, if she was tired, it would get kind of wobbly and she'd have a little trouble. She could start reading at that time, but she would read, do you remember in first grade how you read like homeopathy? You'd read H-O-M-E-O-pathy. You broke up. That's how she had to read, which still wasn't conducive to going back to work, because if you're in the legal profession, you have to read and put your punctuation in and type and write. So that came around, and then about 3.5 months, she could write a whole sentence. She sent her friend an email, and her friend got the email. Now this is interesting. She got the email. This woman's name is very short, and her friend goes, she looked at the email and she goes, and she put it in front of a mirror. It was written mirror image, perfectly mirror image. She had typed it backwards.
Yeah.
So I go, that's weird. MS does strange things to the brain. But then her sister came down and said, what are you doing looking at the computer? What are you looking at? It was the internet. It was backwards. The computer corrected for her and made it backwards. She said, well, I'm looking on the internet. Well, her sister couldn't read it because it was mirror image. Now, computers do that, at least as Mac or Apple did.
Okay.
I don't know if PCs do. But it flipped it for her, so she was able to read on the internet. And then 2 weeks later, she was able to write forward. And if she got tired of just a couple letters, would switch. But not a whole word. She could write a sentence. She went to see her neurologist, who had just said, oh, I'll just see you in 6 months. This person couldn't take any of the prescriptions that he would offer her. And she was rapidly progressing MS, because she's allergic to them, and she's even allergic to prednisone and Benadryl. So if she got into trouble with the medicines, she would be dead.
Oh, yeah.
So she said, I'm not doing that. So she went to see her neurologist at 4.5 months, and he said, I've never seen this happen. Whatever you're doing, keep doing it. She now is in school, studying to be a preacher.
Oh.
And she actually, the profession she was in was stressful and probably contributing to some of her symptoms.
Right.
But again, there is nothing that I would know how to do that with.
No.
I mean, you know, as an MD.
Mm-hmm.
But
Yeah.
she was pretty amazing.
Yes. That's an amazing story.
Yeah,
You know.
it is. It is. So homeopathy does some pretty remarkable things with neurologic things
Yes.
that other places don't. I mean, that allopathic we suppress and use prednisones and immunomodulators and stuff, but we don't do cure, we just kind of dampen the symptoms.
Yeah.
And do PT and OT, which she also did. She did exercises. I mean, she did whole healing.
Yeah, you just gave her the tools. Yeah, that is magnificent. And I know there's a lot of people out there with fibromyalgia. There's treatments out there with Lyme disease. There's so many things out there that the medical profession is at its wit's ends, and they can't even help the people to help themselves at this point in time.
Yes.
And I don't know, I mean, you would hope they'd come to you first, but sometimes you're down the list a little bit, and then they finally come because they've
we're not on the insurance
all
plan, and we're not homeopathy. I mean, doctors will often say, oh, that's just a homeopathic dose of medicine, even in residency. That's a homeopathic dose, meaning you gave too little. But in homeopathy, actually, we give the energy of. So we give nothing but the energy of the substance. And we know it's there.
Now you had a third patient that you were also talking about, too.
The woman with hyperthyroid, and that's overactive thyroid. So her symptoms were weight loss, and she already was quite slim.
Okay.
You know, probably 130 when her weight maybe should be, would be a good weight, and she came in the 120s. So she'd lost quite a bit of weight. She had palpitations, and she couldn't sleep.
Okay.
So they gave her the usual medicines, propofol uracil, which pushes down the thyroid, and then atenolol to kind of keep your pulse down. Well, that was fine, but she still was not sleeping. It didn't help, and she'd still have some palpitations, and she didn't feel real good. So she came to me, and I gave her remedy. Actually, because she's on those two, she got an LM also.
Okay.
She was on that for 5 months and was able to go off those two medicines. She's been off those since. Her sleep is remarkably improved. She had no more palpitations, even, she had a few right when she stopped the medicines, the prescription. But she's done quite well. She's now about a year out. She's still working on some sleep things and some health issues, and still on her same remedy, actually, because it's helping her.
Yes.
So she's done remarkably well and very pleased.
Wow.
Which is pretty fun. Because the other way to treat that, you know, is to radiation and ablate, like kill your thyroid, and then you're on hormone pills the rest of your life, which she really didn't want to go there either.
No.
And I don't blame her. You don't want your neck irradiated, and you'd like to keep it and make it work again if you could.
Exactly. So. And to use these resources, you know, because I mean, this, prior to all of those drugs that we had, you know, people were getting their own remedies back. You're talking, you know, well, 1800s perhaps, in that time. And when these are actually still working. And if I had a choice between the radiation on my thyroid, I know this would be my choice.
Some drops, yeah.
Yeah, something simple like that. Yeah. And I think that'd be the majority of the educated people out there to do that also. Okay, yes.
Well, you know, we want to first do no harm is the goal.
Yes.
And we want to treat our bodies well, but we do have an American culture that wants it right now. And homeopathy tends to be a deep and gentle healing, but it's not always the fastest. But on that little girl, it was fast, but younger kids react quicker because they have less than we adults. We carry around more. It just our life.
We're conditioned. Yeah. And even to believe that this is the right way and the only way of Western medicine. And we're not as cultured as the European countries and the other parts of the world. And